Good day, it's a massive pleasure for us to discuss a very important thing in South Africa. We are privileged to speak to Dr. Neville Vlok from Unitas Hospital Trauma Unit. It's a state-of-the-art facility and we're going to touch base on CPR and the importance of CPR. So Dr. Vlok, yet again, thank you for your time. Really appreciate this and the floor is yours.
Today we're going to be talking about CPR. CPR is the acronym for cardiopulmonary resuscitation. This is basically performed when someone is actually dead and we want to try and revive them to bring back life. This is a life-saving, essential procedure that everyone should be able to perform. The first step to do, and the most important part, is to recognize when someone actually is in need of CPR. When we find someone that's unconscious, not talking, not responsive, the first thing we want to do is to establish scene safety. We want to make sure that we are not putting ourselves in danger when we are performing this procedure. Once that is established, we will then assess responsiveness of the patient. This can happen with a loud tap on the shoulder, a vigorous tap on the shoulder, and asking, "Are you okay? Are you okay? Are you okay?" There's no response. Now I'm worried that this patient might not have a pulse and might not be breathing, i.e. clinically dead. We want to help them, we want to revive them. I'm going to perform a pulse check in the neck. At the same time, I'm also going to listen for breathing. I do not want to spend more than about 10 seconds doing this. Every second that passes decreases the patient's chance of survival. Performing CPR is trying to maintain or establish a circulation which will maintain and prolong life. I will then initiate CPR. This, in a male patient, is easy to perform. We want to expose the chest as much as possible and go in between the nipple line. The idea is to stay on the breastbone in this area with our hands on the lower part. I'm going to lock my elbows and my wrists, and the idea is to push as hard as I can. We want to get a compression of about 6 centimeters. We want to do this for about 100 beats per minute and allow for full recoil. Full recoil means we don't lean on the patient, but we actually have liftoff once we come at the top. It looks something like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're going to continue that and summon help at the same time. We want to activate EMS. We also want to have access to an AED if that's available. In some public places, we do have access to an AED, or also known as an automated external defibrillator. Once the help arrives, now it becomes important that we swap out in order not to get tired, as well as to start identifying the patient. This is sometimes quite difficult, and that's why a product like CrisisOnCall can really help when we have easy access to identification, taking the chaos out of the scenario. I'll now show you how to perform CPR on a child or an infant. Although the principle remains the same of pushing hard, pushing fast and getting good recoil, the hand position might be a little bit different. In a child, we're still going to go with the intramammillary line or between the nipples in the center of the breastbone, but obviously my hands are too big for such a small child. This can lead to one of two scenarios. In infants or in children, one hand is acceptable. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Or if the baby is a bit smaller, you can do the 2-thumb technique or the chest encircling technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. As long as you can get adequate chest compressions with good recoil and doing it between 100 and 110 beats per minute, then you are doing quality CPR. When performing CPR, it's always important to have access to some form of PPE or personal protective equipment. In some scenarios, this is a nice to have, as not all cardiac arrests happen within the hospital setting. We must realize that this can happen not just to doctors and nurses and other EMS and medical personnel, but this can happen to yourself or a loved one, wherever you are. This might be in a mall, a shopping center, the airport, church. So you must be prepared to perform CPR wherever it's needed. Personal protective equipment is a nice to have if there are no body fluids, but as soon as blood involves, it becomes quite important. Although we're showing you how CPR is performed on a bed today, this can happen anywhere. The patient does not need to be on a bed. CPR can be performed on the ground, on a kitchen table, or any place with a hard surface. Sometimes it's a bit easier even to perform it on the floor than on a bed. We're approaching the summer season, and something that we see quite often, especially when water is involved, is drowning. Now, my personal experience with drowning has been quite significant, and every time this happens, it's quite tragic. It's very important that everyone learns how to do CPR. You are the first responder when something like that happens, and every minute counts. If you have access to a product like CrisisOnCall, they can guide you telephonically how to do CPR, in case you didn't do your homework and learned how to do CPR. We're now dealing with a child that's choking. A small child like this is quite easily to hold and to perform either back slaps or abdominal thrusts. A back slap can be easily performed by turning the child around while supporting the head and providing 5 quite firm chest slaps. The idea is to dislodge the foreign body that is blocking the airway. It looks something like this. 1, 2, 3, 4, 5. We'll now turn the child around and assess responsiveness and to assess if the patient is breathing. I now see that the child is still not breathing and the object is still lodged. I'll now perform 5 abdominal thrusts. It looks something like this. 1, 2, 3, 4, 5. I will now continue to do this twice more until such a time that I will then go over to perform CPR if the foreign body is still not being dislodged. This message proudly brought to you by Unitas Emergency Department, CrisisOnCall and with Cherry with Love campaign. As jy van hierdie wenke vandag gehou het, skakel gerus in op Mense wat omgee op Pretoria FM, eerste donderdag van elke maand 104.2 FM, 9 tot 10. Sien julle daar.